Welcome to this very special edition of Harford MagaScene, the impact of the COVID-19 pandemic on Harford County. Life changed for all of us drastically in mid-March when Governor Hogan announced drastic measures to prevent the spread of the virus throughout our county, from closing malls, movie theaters, schools, having people work from home, and traveling for essential reasons only. This has been a very challenging time for all of us. Now our guests will be answering questions remotely to comply with social distancing. Due to the popularity of the show, we actually had to put it into two parts. This is part one. I'm Kristy Breslin, and this is Harford MagaScene. Well, I'm now joined with Dr. Fahim Yunus. He is from the University of Maryland Medical Center, Upper Chesapeake. He is the chief of quality there. He is here to talk to us about COVID-19. Where did it come from? What are the symptoms? And what can we do to prevent the spread? Doctor, thank you so much for being with us today.
Thank you so much for having me.
Now, Dr. Yunus, what exactly is COVID-19?
So, this is a novel, a brand new coronavirus, which no one had any immunity to it. It's a respiratory virus that causes infection of the upper and lower respiratory tracts. And now we know that it actually impacts other parts of the body as well. Typical symptoms are fever, cough, shortness of breath, chest pain, and severe body aches. But what makes it a little bit more scary is that up to 20% of the patients, at least in the early phase, may not have any symptoms and still be contagious. So that is why all the precautions that we require are necessary.
Now, doctor, are there two different strains of the virus? If so, does that mean we could actually get it again?
So I believe that there will be many strains of the virus. Every time the virus infects a new person, it's a clumsy virus. There is some mutations that happen. However, those mutations are not clinically significant, meaning it does not change the mode of transmission of the virus or the way we treat it. It's just like the dandelions in the backyard. They all may be a little bit different, but they're still dandelions. So I don't think people should be afraid of different strains. As far as immunity, it's a great question. It's a new virus. We don't know for sure, but my 20 years of experience in working with viral illnesses tells me that once you get a viral illness and you fully recover from, then you will have some immunity. Whether that immunity lasts you 3 months or 3 years or 30 years is debatable. But I think, yes, there will be some.
Now, at first, we thought it was just the older generation that was getting the virus. We thought they were the ones more susceptible to it. But now we're hearing people in their 20s, their 30s, their 40s. We're even hearing about children getting the virus. So, who is susceptible to it? Is it all of us?
That's a great question. So I think everybody's vulnerable. Nobody's immune to it. But what we are seeing in the world, as well as in Harford County so far, that folks over the age of 60, those who are immunocompromised, those who may have cancer, who are chemotherapy, hemodialysis, or biological agents or steroids, those are the folks who have a higher risk of getting to a hospital or even dying. So anyone can catch the infection. The outcomes we still believe are worse in the elderly and immunocompromised. But no one is immune. No one should think that I can just go out and party and I'm immune to this virus.
We've been hearing a lot of different theories about how the virus came about. What is the exact origin of COVID-19? Where exactly did it come from?
We believe so far that this coronaviruses are endemic among animals, and this particular virus most likely originated in a bat, then went into a pangolin, and then jumped into humans. This happens all the time. There is a tendency for these viruses to percolate among the animal kingdom, and every 10 years or so, one of these viruses hits a lottery and jumps into the human kingdom. At the same time, I am aware if you're thinking that some people believe it's a man made, lab made virus, so far the evidence scientifically is not proving that. The good paper in Nature, one of the leading journals in medicine, actually had authors from Australia and Europe and US, and they all looked at the virus. And then, to put it in layman's term, there can be some fingerprints when you manipulate a virus, and none of those fingerprints were seen. So I don't think currently there is any data to suggest that it's man made or lab made.
Doctor, what should we do if we suspect we have it? Because right now, I guess going to an urgent care or even the hospital is kind of out of the question.
It depends. I think there are multiple parts to this answer, and let me take them one by one. Most healthy people will get better. About 80% of the people will never need a hospitalization. Once testing becomes more adequate, you can always call your doctor. I don't advise anyone to go into a doctor's office or a nursing or a ER. We're trying to practice social distancing and protect our front lines. But through telemedicine, you could get an order and you could get a test done out in the community. Upper Chesapeake Health is providing one such service as well, where we have this mobile sample collection. That's one aspect of it. At the same time, I don't want people to be afraid of hospitals. Now, I'm not talking COVID, I'm talking regular heart disease, wounds due to diabetes, stroke, GI bleed, COPD. Hospitals are safe places. We are practicing the best personal protective equipment and policies that there are out there. My worry and the worry among my physician colleagues is we don't want patients to neglect their health because of a fear of hospitals. We don't want to see diabetic foot wounds turn so bad that people have to lose their limbs. We don't want people delaying their care for chest pain. So I think it's a big composite. For COVID, yes, there are ways to get tested, even without leaving your car. You can drive to that sample collection, get the test ordered by your physician, and we are here to help you. I think this is the time for all us to be together. We want our community to remember that Upper Chesapeake Health was there for them when this thing happened, because we're going to get through this one day.
I sure hope so. Now, speaking of getting through it, a vaccine. Is there a vaccine in the works? And if there is one in the works, how long till we would be able to actually get it into our community?
Sure. So there are more than 40 vaccine candidates that are being researched and tried right now. I think I've never in my career seen this sort of scientific collaboration globally and this sort of a rapid response. I know this may be too slow for some people. The reality is you have to understand that a drug or a vaccine typically takes 5 to 10 years to develop. That's how long those pipelines are. Just think of it like undergrad. A typical undergrad college will take 4 years. If you're the absolute brilliant student with tons of AP credits, you may do it in 2 years, but there is no way to do it in 6 months. So there are certain realities you have to face. And I think for vaccine development, if we get a vaccine, my hunch is in a year or 18 months, we will have more than one vaccines, perhaps some from China, some from Europe, some from US. And that's the kind of collaboration we need at this stage. The virus is united against mankind. We have to be united against this virus if we have to win this pandemic.
Absolutely. And let's talk about the impact because it's having a major impact on Harford County hospitals and frontline employees. So elaborate a little bit on that.
While I walk through the hallways of Upper Chesapeake Health, I truly feel like I'm walking through a bunch of soldiers. So, talk of being purpose driven. I think the front line is, and when I talk about it, I'm not saying this doctors or nurses. I'm talking about people who are cleaning these hallways, people, the techs who are taking care of these patients, the food and nutrition, the security, anyone, and even beyond the walls of the hospital. So, yes, there is a lot of stress, understandably so. All human beings feel anxious when you don't know about the future. But the beauty is that this team is razor sharp, focused on providing the best care to all patients every day, whether they have COVID or non COVID. Along with that come certain pressures. I think we are trained professionals. We can't complain. Our job is to meet you on the other end of this pandemic curve.
Well, we are lucky to have someone of your caliber talking with us today, and we're lucky to have a hospital such as University of Maryland Upper Chesapeake right in our backyard. Now, from your medical perspective, how long do you think it's actually going to take for these numbers to decline and when we could see, maybe some kind of normalcy?
So, once again, I think nobody knows. The places with high population density, of course, are going to have different outcomes as compared to places with low population density. Even currently, if you look at the map of Maryland, places like PG County or Baltimore County, Baltimore City, and Arundel County, they have much more cases. So I think this may take months, this may take a year. It's not about the date, it's about the data, because we don't get to control how the virus behaves. We do get to control the data and the social distancing policies, where Maryland was one of the first states to institute those policies. So I think what people should know, that they are blessed to be living in a state where there is absolute top to bottom unity, from our governor to our political machine to our Upper Chesapeake hospital to our University of Maryland 13 hospital system to other hospitals. So I think this is the beauty, that we are unified in our response. I can't predict the date, but I'm pretty hopeful that we will hit the best possible date because of that top to bottom alignment in our response.
Dr. Eunice, let me ask you, if you wouldn't mind, could you give our viewers some words of encouragement and maybe give us an idea of the best precautions that we can take for ourselves and being around others to avoid being infected with COVID-19?
So precautions first, and some advice after that. I think as far as precautions are concerned, again, as a state, we're doing a wonderful job. You could Google all of that. Wear a mask when you go outside, follow all the government orders, maintain 6 feet social distancing wherever possible, wash your hands, get good sleep. Because one thing you can do to prepare for this virus, God forbid, if it comes at you, that your immune system is going to have to fight it. All the medications are currently experimental. We don't want you to get so far along where you need a ventilator. How about we prevent that? Eat well, do good exercise, get some digital disconnect. Have some time in your day where you are disconnected from your devices and really energizing your soul. Now, as far as what can we do, what is the advice? Just look at the trees outside your house. They're beginning to bloom now. They went through a harsh winter. They do it every year. They lose all their leaves. They survive in sub zero temperatures sometimes, but they don't die. After every season, they come back and bloom again. They do it every year. We have to do it once in our lifetime right now. At least I had to do it once in my lifetime. I think the lesson from the trees is a profound one. This is a harsh winter for us. It's not easy, it's difficult, but we will come back again. Our economic losses are like those leaves. I understand there is an economic price we're paying, but let's be generous to each other. And that money will come back. Those leaves will sprout and bloom again. But let's not be hopeless.
Dr. Eunice, I can't thank you enough. Great advice. I really appreciate you taking the time out of your busy schedule. You're speaking with us on a Sunday. Very grateful on my end, and thank you for the words of encouragement. They're much needed.
Thank you very much. And I just want our folks to remember, we are going to get through this. And University of Maryland Upper Chesapeake Health is here for you today. And we will want to be remembered that we were there for you at the time of need. We're all one. This virus is a great equalizer, and we are going to cross this curve together.
Dr. Eunice, thank you so much for being with us. Your words of advice are very encouraging. And as I said, right now in this time of uncertainty, that is what we need. And it's so nice to know that you're right there in our backyard and you're willing to help.
My pleasure. Thank you very much for having me.
Well, you heard the words of expertise from one of the top medical experts in Maryland. Coming up next, much more on COVID-19 and what can you do to prevent the spread. Stay with us. I'm now joined with PJ Chambers, president of Web IXI, and also from the Nonprofit Advisory Group. As you all know, it's a tough time for all of us. The nonprofit community is really struggling, but they are still here for you, and there are still ways for us as community members to give back. PJ Chambers is here to tell us how to do just that. Hi, PJ.
Hey, Kristy, thanks so much for having me.
Thanks for being here. Now, PJ, tell me, how is the coronavirus, how is this affecting our nonprofit community?
So it's actually affected them quite a bit, and depending on the calls and everything that you're focusing on. First off, all the events were effectively canceled immediately because most of the nonprofits immediately were 250 people and over at most events. So that canceled most of them early on, and then the threshold kept coming down. So a lot of the nonprofits either had to cancel entirely, or if they were lucky, they were able to reschedule. I know a lot of the funding opportunities that the Lions clubs and the Rotaries and things of that nature, they're not going to be in the position that they have been in previous years where they can actually fund additional nonprofits because their fundraisers just weren't there. In addition to that, hopefully by October, things are going to be slowing down a little bit and reopening so that we can actually have these events, because October is getting packed already just based on the number of nonprofits that actually did reschedule their events for the fall, effectively avoiding the summer entirely just to be safe. So we've got that, but then we also have things like the Harford Community Action Agency, where because of their calls and the different programs that they have, they've actually been very, very fortunate because Harford County, which I just absolutely love because of their giving nature, whenever there's somebody in trouble, Harford County always comes together. So Harford Community Action Agency, they have their emergency food bank, they have their utility and eviction prevention programs. They've got the homeless programs, all those things like that. But when the schools shut down and they made that announcement on March 13th, I think was the last day for that.
Yes.
That Thursday evening, Harford Community Action Agency actually emptied their emergency food bank. And what they did that evening, they worked all night. They made 200 care packages, food care packages, that they then took to Title I schools to help those kids, because they still had that last day for these kids that were relying on the schools to actually get food. So while that was happening, no more food in the food bank. So we launched a virtual food drive. And within 12 hours of that happening, Harford County came together in little $1, $5, $10 donations, raised over $15,000 in the first 12 hours. Effectively, it then went over 25,000 because we all came together, because that particular cause was what COVID-19 is actually really affecting with all the shutdowns and things of that nature. It's been especially brutal for them because usually they've got about 200 families per week that will actually go through the emergency food shelter.
Right.
And now it's over 500. And what's happening and what's really scary is the fact that it's normally operated as the emergency food bank. And then they distribute food elsewhere to all the other food banks in Harford County. Well, they've removed the emergency part here, because what was happening with the emergency definition is the fact that families can come in there for emergency purposes. They would give you 4 to 5 days worth of rations, but then you weren't allowed to come back for 30 days. And that's how they but they've actually lifted those restrictions because there's been such a need with this. Furthermore, the nonprofits in the area, no one's being able to take donations. So people like me, I've been here in quarantine for a month and a half now, and I got a dumpster because as I'm sitting here, I was like, well, I might as well clear out the closets and everything like that. So I got rid of all the trash, but then I've got a pile of just old clothes and things of that nature that are still fine condition, but I have nowhere to donate them right now because everything's shut down and they can't actually take physical donations. So it's been a very, very difficult transition for a lot of these nonprofits that are used to, buy the book, and this is how we've been doing it for 20 years. What we've noticed is that this has been a particularly nice time for nonprofits who are able to transition into a more virtual role. And in terms of also relationship building has been huge recently. I know a lot of our nonprofit clients have been reaching out to potential sponsors and partners and things of that nature on LinkedIn now, not necessarily to ask them for donations or anything like that, but just because we know that everybody's sitting at home and twiddling our thumbs and doing that sort of thing. So suddenly a lot of people have a lot of time and are looking for some sort of outlet like you and I are doing, where I will happily talk to you right now, please. So they're actually been very, very successful in actually creating these new relationships where, all right, let's just talk about how we can help each other once all of this gets back to normal, which has been very, very helpful.
Right. And obviously we don't have a time frame for when this is going to go back to normal, but these nonprofits nonprofits, I know that they need our help more than ever. Now, some things, PJ, that I've seen a lot of them go virtual with the virtual fundraisers, as you mentioned.
Absolutely. So, like the virtual food drive was very, very successful, and we just need to get creative. So, for example, I'm also in the Southern Harford County Rotary, and we can't meet, we can't do anything like that. So, we've been doing the Zoom meetings, like I was telling you, and but what was really cool was. The Rotary District, we have this international granting. So if you donate to the International Foundation, in 3 years, it comes back to your community. So you can apply for it. Well, what they ended up actually doing was relaxing the grant guidelines, because there's certain criteria and everything that you need to be able to do in order to get that funding back. And they said, okay, all you need to do is find me a nonprofit that has been affected by COVID-19. Just tell us what it is and things of that nature. So we were very, very fortunate when we just got approved. And at first, we got the last dollars in that grant period. It's going to be a matching grant. It's going to be for $5,000. And we're partnering with Harford Community Action Agency's board. And they're going to do a matching grant of $3,000. So what we're going to be doing as not just our Rotary Club, but all the Harford County Rotaries in general, we're going to be doing another virtual drive to actually meet those requirements, because now we can all sit here. We can all do this from our home, because we just have to change the way that we're doing it. The other way that things are getting very, very creative is a lot of people have been launching webinars,
Right.
which has been hugely helpful, because not only can they actually utilize that to get in front of audiences and for their different topics, things of that nature, like no more stolen childhoods. They focused several webinars this month because it's Child Abuse Awareness Month. So they've got these counseling grants for people to help fund counseling for adults who are looking for help. They were abused as children, and they've never actually gotten the necessary help that they've needed. So now we launched one webinar for them, and they actually ran out of grant money. They actually completely. So now what they're doing is, okay, we're going back to the board. We need more money because we ran out of this pot after one webinar. We've got 3 more scheduled. So
Wow.
it was great because you got in front of a brand new audience that had no idea what was happening. And we actually partnered with one of the nonprofit conferences that we were supposed to be attending as a vendor there, but they couldn't have the conference, of course. So they actually got the word out to all the attendees who attended the webinar. So it was just partnering like that and just twisting about how we were going about doing business as usual.
Well, I'll tell you, PJ, one thing is obviously this is a really tough time for everybody, but it's so nice to see how everybody's really just coming together to help one another. And as you had mentioned, a lot of these people are worried, okay, well, how am I going to get my services, or, how am I going to get my
Mm-hmm.
food? But you're telling us these nonprofits have not abandoned us. They're just looking for other ways to
Oh,
help us.
absolutely not. Yes. So I keep going back to Harford Community Action Agency because they're on the forefront for this. Of course, with the social distancing, their lobby is shut down and things of that nature. So they can't really see people like they used to, where people would come in. So they've moved the food delivery out, food pickup outside for social distancing guidelines. They are still here for everybody. In fact, what they also did was create a mobile food pantry so that for the people that can't actually drive down here or get there because public transportation, everything like that, social distancing guidelines, we can still get them the help that they need. It's been fantastic. And then just the general public in Harford County. So like I was telling you about those virtual food drives, I know several college kids, I actually saw their donations coming in, and they donated $1. And I'm looking at this, I was like, that dollar meant more to them than $500 would be to, because I know what kind of financial situation that they're in, but they still gave that dollar because they know that there are less fortunate people in the area. And, by the grace of God, it wasn't us this time, but it very well could be. And Harford County is just continuing to give back. For the people that need help, it's there. And for the people that can't help, they're still doing it.
It's so great to see that. And, for college kids, the dollar, that's a pack of ramen noodles. A lot of
I was going
college
to say,
kids lived off of them.
$1 goes a long, long way for a broke college kid. That's for sure. Yes.
Now, PJ, for all of our viewers out there that they need help, or they want to get in touch with a nonprofit, or maybe even at home, what can we do to help the nonprofit community?
So what I would suggest is actually reaching out to the individual nonprofits first. I know, at least for my clients, we're getting a flood of volunteer requests, but the problem is that we can't actually bring you in to volunteer physically at this point. So we have to get a little bit creative about that. So for the particular volunteer requests that we've been seeing, each person we basically reach out to them and say, okay, what are your passions? What can you do? This is what we can do for you, that sort of thing. I know the other thing that I would strongly suggest to people is now is the time to join like the Lions clubs and the Rotaries and things of that nature. I'm members of both the Bel Air Lions Club and the Southern Harford County Rotary. And even though we're not physically meeting right now, we are still absolutely coordinating efforts to help the local community. So we're getting very, very creative with that, creating care packages, food drives, all sorts of things. And now would be the time to absolutely join because it doesn't take a huge financial commitment. In fact, one of the things that you could absolutely do if you can't contribute financially is just sharing the posts goes a long, long way. So if you're on social media and you see one of your favorite nonprofits and they're posting calls to action or help or things, just share the post.
PJ, thank you so much. A lot of really good information out there. And as I've said, so nice to see our Harford County community coming together to really lend a helping hand to those in need.
Oh, thank you, Kristy.
And now we have a very special message for you from our county executive, Barry Glassman.
Hi, this is County Executive Barry Glassman. I'm coming to you from Bel Air, Maryland, and we are in the midst of a pandemic. As you all know, Harford County is responding to the COVID-19 pandemic that is going through the country and here in Harford County. You know, first of all, I just have to thank all of our first responders, all the frontline healthcare workers that are working around the clock, in addition to my county employees who are acting as essential employees to keep county government moving forward. We're following the governor's directions, and I would just urge everyone to follow the social distancing. Currently, we are also wearing masks and follow directions to make sure you continue to wash your hands and all the things that the health department is advising us to do. You can visit my county website, www.harfordcountymd.gov, really to follow weekly information on what to do, where to get help, all the resources you need here in Harford County and across the state. I would also urge you to stay informed and follow guidance from the CDC and our county health department, who's helping us from day to day. We're going to get through this together. Harford County has been blessed in the region. We don't have the most cases. We continue to watch certain areas of the county, and hopefully within the next few weeks, we'll be emerging on the other side of this pandemic. So I just urge you to stay calm, stay informed, and be safe, and stay Harford strong.
As you've all heard today, staying home is one of the most important things that we can do to combat the COVID-19 pandemic. We want to thank all of the workers, the essential workers who are on the front lines helping to take care of our community. You are the true heroes of Harford County. I'm Kristy Breslin. See you next month on Harford MagaScene.